everyone. My name is Loretta Lou. I am an assistant professor in the Department of Anthropology and also the degree director for the MSc in Global and Planetary Health. So today I'm really pleased to have the opportunity to talk to one of our current students, Dr. Miriam Ansco. And so she's going to share with us a little bit about why she's coming to Durham and what her experience has been. So, Miriam, why don't you tell us a bit about yourself?
Yeah, certainly. So my background is that I'm a practicing GP. I originally trained at Southampton University Medical School, and then I did my GP training in Portsmouth. And I've worked predominantly for the NHS since then, just providing routine day-to-day primary care. And then more recently, I've worked in a role with an occupational health component to it. But about 3 years ago, I decided that I wanted to study some of the social and cultural aspects of medicine to give me a better understanding of the wider societal context of my day-to-day work, and to help me recognise and think about the social influences which affect my patients' lives and also the way that I do my job. And I also felt that while sustainability in healthcare is getting increasing attention over recent years, it's not yet treated with the level of importance that I feel it should be. And this was something that I wanted to learn a bit more about. So I decided to enrol for the Global and Planetary Health MSc programme at Durham University. And I've been studying part-time alongside working as a GP over the last 18 months.
That's great. So there are so many anthropology departments in the country. Can you tell us why you choose Durham?
Yeah, so the university and the Department of Anthropology specifically are very highly regarded, both nationally and internationally. So I knew that this MSc programme would provide an intellectual challenge, as well as looking good on my CV. I like the structure and the content of the course specifically. There really aren't very many similar courses available currently in the UK. And so this felt like an opportunity to choose something particularly new and groundbreaking. And then finally, there's a huge range of research activities going on in Durham, groups, institutes to get involved with. And that was also a factor because I knew that I wanted to do a course that was based on up-to-date knowledge.
That's great. So
Current
you
thinking on some
mentioned,
of the problems
yeah.
that we're facing in healthcare.
We have a slight delay, but I hear it now.
Sorry.
So, no problem. So, how did you find the master's study in global and planetary health? You've mentioned the curriculum, you've mentioned the course content. How do you think they enhance your professional practice as a doctor? Because you are doing it part-time, so I guess you will be able to kind of reflect on some of those things that's been discussed in the classroom in your medical practice.
Yes, I mean it's been a fascinating subject to study as a doctor, because it's enabled me to answer a lot of questions that I'd really been grappling with over the course of my career so far, and it's really encouraged me to think about my role as a doctor, both as an individual and part of the broader social context of UK primary care. And it's helped me to understand the intersecting social, economic, environmental aspects of health, which are all part of the landscape of healthcare in the 21st century.
I'm really glad to hear that. So finally, what advice would you give to medical students or fellow doctors like yourself who's been practicing for many years, who are very experienced? What advice would you give them if they say they want to study medical anthropology or global and planetary health?
Well, I would say that if you're interested in how our lives and our health and that of our patients are shaped by social and political and environmental factors, then this programme is a great opportunity to explore those connections between all of those areas, because they are all connected, and the extent to which those connections affect all of us is still emerging. So it's a very rewarding subject to study. I would suggest perhaps some background reading to gain some knowledge of some of the themes which link in with medicine and health. So the Lancet Planetary Health Commission, which was supported by the Rockefeller Foundation, was published a few years ago, but it's a valuable overview of the concepts of planetary health and its relevance to social and environmental determinants of health. And the BMJ publishes a special climate issue each year and has an ongoing series of editorials and articles which connect planetary health to other facets of medicine and medical practice. So there are some accessible ways to find out about the cutting edge thinking around planetary health.
Great. It's wonderful to hear from you, and thanks so much for sharing your experience with us today. So if you are interested in this MSc program, please do not hesitate to contact me. Yep, so thank you very much.
Thank you.